Our legislative assistants are asked to do quite a lot in the State House of Reps. Sometimes at the height of session, hundreds, maybe thousands of emails, every couple of days. And you're also trying to figure out how to make the policy priorities and concerns that we have legible to people.
I am Representative Sean Scott's legislative assistant. He represents the 43rd Legislative District, which is where UW is located. It's also where I happen to have grown up and spent my entire educational journey in undergrad and as an MPH student.
We're involved in all of our policy conversations, the political conversations about, which members that we might want to appeal to around certain bills. There's so much information that you're sort of bombarded with on a day-to-day basis. So her ability to synthesize that, both back to me and to other stakeholders that come by our office to talk about our priority bills, it's been indispensable. Very, very difficult to imagine being able to do this work without Kalia right out in front with our office.
As I was learning more about public health, learning more about all of the things that it touches. Of course, it's epidemiology, but there's also so many other components that are really community-based. You really start to see how everything is interconnected. And I think that the thing that's really cool about being in an alternative environment to what you might expect someone with an MPH to go do is that all of our bills have public health implications.
And when you come to Olympia, you see these really tall steps that are behind me. So the inaccessibility of it is right out there in the front. If you can't make this climb, if you can't come up step for step, you're not welcome, unless you have people on the inside that are trying to make what's happening on the inside relatable to people who are on the outside. Public health is about attentiveness and it's about accessibility. And those are two also very, very important qualities to have in the State House of Reps.
As I was searching for MPH programs, I think that the community-oriented element of the program just really stood out to me as why I wanted to be in public health. The opportunity to do real community projects and work with real stakeholders and work with real community members along the course of the COPHP program was a really powerful draw. The problem-based learning, the PBL process, I think also really does teach you and prepare you to go and work in the real world. You're, provided all of these different tasks, all of these different challenges, and you have to strategize your way through them. And sometimes there are things that come up that you may not expect or you may not have encountered before. And essentially learning how to be resourceful and think your way through a process, I think that makes all the difference. I didn't know exactly where I wanted to end up when I began in the program. I really viewed going and getting my Master of Public Health, and specifically in the COPHP program, I viewed it as the world is my oyster. And there are so many opportunities that you can go and seek after the program, similar to the way that I think public health really touches every element of our life and society and state. Policy does that as well. And so it really became like a good opportunity to intersect the policy and the public health elements.
I think Kelly has been exceptionally well prepared for this role. And it has to do not just with the professional background, but the personal background. Having roots in the 43rd LD, understanding our constituency, that's been, and saying it'd be an asset to the office, I think is a real understatement.
I'm excited to continue to grow in the role that I'm in because I do kind of get to, like you said, get my feet wet. I get to be part of the communication strategy. I get to be part of the stakeholdering with the community members that looks at how Rep. Scott wants to craft his bills and how he wants to take his policy forward. When you are developing policy, you want to think about how that communications would take place, or vice versa. If you're in comms, you want to think about what does this policy really mean and how does it affect the community?
I feel like we're talking about public health more now over the last 5 years than maybe we did in the previous 50.
This is such an incredible opportunity to be part of stakeholdering and community work and policy development that ultimately affects so many different elements of public health: housing, healthcare, higher education, workforce development.